Hi, my name is Junjie. I'm a PhD student at UCL Center for Adolescent Rheumatology, and I will be talking through our study, which is patient-specific and disease-related determinants for cardiovascular disease (CVD) risk stratifications in the APPLE clinical trial cohort. Juvenile onset systemic lupus erythematosus, or JSLE, is a rare chronic autoimmune disease onset before age 18. Cardiovascular disease (CVD) is a leading cause of mortality in JSLE patients associated with atherosclerosis. At the moment, there is no guideline for the monitoring or management of CVD in JSLE patients. In this study, I reanalyzed the data from an clinical trial called APPLE, which stands for Atherosclerosis Prevention in Paediatric Lupus Erythematosus, which is a 36-month clinical trial designed to assess the progressions of atherosclerosis in the placebo versus atorvastatin-treated JSLE group. It's the first randomized clinical trial assessing the efficacy of statin in preventing atherosclerosis progressions in children. We used the carotid intermediate thickness cIMT scan, which gives 12 different measures of the inner layers of the artery for assessing the atherosclerosis progressions of the patients over 36 months. Patients' metabolomics profile were also collected, as lipid metabolism dysfunction is strongly related to atherosclerosis development. And so in this study, we want to identify JSLE patients with higher risk of developing CVD, and we are hoping to discover more reliable cardiovascular biomarkers for JSLE stratification. And the first method I used was to stratify the JSLE patients based on their baseline cIMT measures, and we can see in Figure A, 3 groups were identified as low, intermediate, and high baseline cIMT. And if we look at the trajectory of cIMT over 3 years, we can see that the baseline cIMT groups tend to remain in their position. And when looking into the demographic and socio-economic factors, interestingly, we can see some trending in terms of race, household income, BMI, and mother's education. For example, in the high baseline cIMT group, we see a higher proportion of Black patients, relatively lower household income, higher BMI, and relatively lower in terms of mother's education when comparing to the low baseline cIMT group. And in order to identify patients with different CVD risk, I then tried to stratify the placebo-treated JSLE patients using the delta cIMT at 36 months. And from the heat map, you can see the patients were divided into 2 groups with lower and higher cIMT progressions, indicating their long-term CVD risk. On the right-hand side, I correlated all 12 delta cIMT with the clinical measurements from the JSLE patients. From the circle plot, we can see the disease damage score SLEEK, disease activity score SLEDI, as well as white blood cell, complement C3, blood pressures, and BMI all have significantly positive correlations with cIMT progression. And then I tried to compare the metabolomics profile of the high and low cIMT progression group. From the volcano plot, we can see distinct metabolomic signatures between the 2 groups, where most lipids are upregulated in the high CVD risk group, especially the LDL. After using a more stringent adjusted p-value, 6 metabolites were selected as potential biomarkers. Using the top 6 metabolites only, our ROC analysis is able to distinguish high-risk group from the low-risk group with the 81% area under curve. Finally, we use our independent UCL-JSLE cohort to validate our markers. Using our top 6 metabolites, I was able to stratify our UCL-JSLE patients into 3 groups, indicating their long-term CVD risk. When looking at their immunophenotyping data, we found that the frequency of both classical and non-classical monocytes, which were identified as markers of early development, of atherosclerosis in multiple studies are significantly different between the three groups. So in summary, our analysis of cIMT at baseline and progressions at 36 months in the APPLE clinical trial cohort enables CVD risk stratifications in JSLE. The identified JSLE patients group had distinct metabolomics profiles associated with unique patients and disease-related factors that could guide further research for minimizing cardiovascular risk in JSLE. Thank you for listening.